Well, welcome everyone to our very first Innovation Thursdays session. We are excited to have some time together where we can explore some innovation strategies and talk to a few subject matter experts and leaders in the field who are really thinking outside of the box when exploring innovations in maternal health. My name is Pia Hansen, and I am with the MHLIC, the Maternal Health Learning and Innovation Center. And I am honored to welcome the session and also introduce today's presenter. We have just a few housekeeping things that we are going to launch into before we get to the meat of our presentation. And so if you'll bear with me, I will go through just a few slides before we get to the fun part of today. So if you could just indulge me, please utilize the chat to type in your name, your organization, and then also where you are joining us from today, where you're zooming in from today. I think this will also help us to get a sense of who we have on the line, and then if you're so inclined, the various roles that you have, just so that we can know who we are engaging with. Next slide, Linnell. Thank you. We have just a quick agenda for today. So just to level set and let you know how we're going to be spending our time. I want to go over very quickly our objectives for the session. We're going to review exactly what the MHLIC is, who we are, what we're doing, how we're doing it, why we're doing it. I will introduce our speaker, and then we will wrap up with some Q&A for today. So what are our objectives? We have two main ones. First, we want to describe the maternal health issue that is addressed by the innovation. And then we want to describe at least one feature that makes this particular approach innovative in the scope of maternal health. So that's what we're hoping to get out of our call. So before we launch in, let me just level set just a little bit and let you know who we are and why we're talking to you today. So I have a very quick overview about the Maternal Health Learning and Innovation Center. And before I tell you more about who we are, I just wanted to make sure that we acknowledge and appreciate our funders, HRSA, who has actually made this opportunity possible for us today. So thank you. I think we have a few of those folks on the line. Truly appreciate all of your energy and effort. So who is the Maternal Health Learning and Innovation Center? So as you can see here on the screen, our mission is to foster collaboration and learning among diverse stakeholders to accelerate evidence-informed interventions, advancing equitable maternal health outcomes through engagement, innovation, again, while we're here today, and then a policy. Our vision is really that we would be an exceptional national resource center for eliminating maternal health inequities and improving the well-being for all families in the U.S. So a little bit about our charge. We are really working to build a nationally prominent resource center to house training materials, online resources, and then host communities of practice. We're getting folks together to actually engage with each other about what they're doing, what's working well, and then sharing strategies about opportunities that are available to them to shake things up and do things a little bit differently. We are also working to expedite the translation of knowledge to practice through training, technical assistance, and capacity building activities. So our areas of focus, which I stated very briefly, are engagement, policy, and innovation support. What exactly do we do? Well, we provide capacity building assistance to state and community teams. We serve as a collaborator and also a connector for maternal health advocates. We provide national leadership on maternal health innovation and opportunities to address equity in maternal health outcomes. And then finally, we also really are working to find and share and then develop resources around maternal health innovation. Who is our audience? Well, they are folks like you, actually. They are maternal health practitioners from all areas, and then also our state MHI and RMOMS programs are our audience as well. We don't do this in silos. There's actually no way we could do this work on our own. So we work with a whole host of partners to actually implement these activities and allow this work to come to fruition. And so you can see here on the screen, we're combining expertise with lots of partners that have expertise in rural health, policy, equity, community engagement, maternal health innovations, state health department context, and then also implementation of innovations. So why are we here today? We're here for Innovation Thursdays. So what we thought would be fun, maybe that's our idea of fun, is to share some of the innovative practices that we're learning about with the broader audience. And so just for a few months, we're going to take the first and third Thursday of every month to highlight some of these practices. And so we're excited to share that with you. This is an opportunity for our speakers to present a little bit about what they're doing, how they're doing it, why they're doing it, some of the strategies that they're utilizing, share best practices, share some lessons learned for things maybe that aren't going so well, allow you to think through how you might be able to work with organizations like them or incorporate some of what they're doing into your work also. And then we'll have an opportunity for a Q&A after so that we can really dive a little bit deeper. So we hope that you will join us for the next few months as we delve into some of our innovations. So that's why I says, I think it's fun. I hope that you will find it fun also. So with that, I've done a lot of talking. I would love to introduce our speaker for today. So this is Ms. Ivelisse Endino, who comes to us from Radical Health. She is an Afro-Latina health equity innovator, born and raised in the Bronx. She, is the founder and CEO of Radical Health and a commissioner on the New York City Commission on Gender Equality. She enjoyed a fledgling career in health tech, pioneering some of its first digital health solutions, including bringing the first mobile app prescribing platform to market and working with global clients such as the National Health Service, London, and Kaiser Permanente. While she routinely trained oncologists on drugs, she found herself unprepared when her own mother was diagnosed with cancer. And that really forced her to directly and intimately confront some of the systemic issues that she knew, or some of the systemic healthcare disparities that she knew existed. And so in founding Radical Health, which is the first Latina-owned and operated benefit corp in New York City, she has sought to combine her expertise in healthcare and her passion in community organizing. So coming from a historically marginalized community herself, it was important for her to initially build Radical Health by bringing together her neighbors that were around her kitchen table. And as so many of you are doing, also thinking through how you can actually hear very firsthand from them and their voices about what's happening. And so she did this by including the undocumented, women of color, elderly, young people, and LGBTQ, who are otherwise figuratively and literally never given a seat at the table to have a say in their own healthcare destiny. And so through Radical Health, Ivelisse has committed to the task of transforming healthcare by facilitating health literacy and self-advocacy, as well as forging a relationship between meaningful face-to-face conversations with cutting-edge technology. So with that, I am excited to turn the screen over to Ivelisse.
Hey y'all, I am thrilled to be here, really thrilled to be chatting with you all. Pia, thank you for that lovely intro. And it's often awkward to like hear yourself reflected back at you. But as you were chatting, I was like, oh my, what a journey. And also like what an honor to build with so many people. And I think a lot of what I do and how I do it is not because I'm so great, but really because of the shoulders that I stand on and the folks who are kind of at my side, and really kind of for the folks coming behind me. So it's just a joy and an honor to be here and chat with y'all. I know that we have a recording happening and live folks. So I'm always, how can we make this as interactive as possible? So I'm going to chat a little bit, but also at any time, feel free to chat me. And for folks who are watching this later, you can always send us notes and chat back and forth or however you handle that. I'm going to share my screen and just kind of talk a little bit. So first, I got into this work largely, I often say this isn't necessarily as professional as it is really personal for me. And so starting Radical Health and continuing to do it is I don't have the luxury of sitting in my apartment and not, and imagining and theorizing about, what could it look like or what are the challenges of healthcare in the world today. I sit in my apartment and I live it. My neighbors, personally, with loved ones, close friends, even with my own birth of my child. So what even started me in the maternal health space was, all the stats that we know and we talk about, I lived through. And, to date, I have a 6-year-old, but between me and my friends, and again, like I'm not that far removed from these challenges personally, which is why I fight so hard professionally. So I'm going to share my screen and let's jump in. So a little bit about Radical Health. And for those of you, again, feel free to chat in as you have questions. We make it really easy for people to come together to ask questions and to know what questions to ask to ensure you're being taken care of. We'll dive a little bit deeper into what we do and how we do it. But at its core, Radical Health really uses conversations that happen, again, person to person and over chat and texting to make sure that folks know what needs to happen. When we think about healthcare, and just a little bit of framing, power, information, access, resources in healthcare are unequally distributed. We're really here as an organization, and I think for a lot of you on this call, to change that, right? Healthcare is complicated, and so it does not matter who you are. Right now, there are 70 million people in America who don't understand basic health information. And this has absolutely nothing to do with how smart you are, how much money you make. I have plenty of friends that are doctors, nurses in the healthcare world, and it is just complicated. When we think about that complexity, right, there's also a challenge around trust and what I'd say even confidence in the healthcare system. Today, only 44% of Black Americans trust the healthcare system to do what's right for them or for their community, and that's about 20% less than their white counterparts. So it's complicated. We don't have a lot of confidence in the healthcare system, which I think means, right, that we're not engaging, that it is then difficult, it's challenging, it's intimidating to ask questions, to be an active participant. 50% of people who have what is commonly known as low health literacy ask 50% less questions of their doctor or their healthcare provider when they're in visits. That the equivalent I often say in real life is like if you go in for a job interview and they ask you, hey, do you have any questions for us? And you're like, no, you might still get the job. You definitely have a better chance if you're asking a question, even if it's one simple question. When we think about these challenges, we really like to couch them under this term that we're calling healthcare fluency. I think we've often heard a little bit about healthcare literacy and like, how much do you know? And that's only one piece of the problem that we see here today. Literacy, the actual act of like knowing what's happening, right? If we think about COVID as a really great example, like when it first came out, like there's the literal piece of like, what is COVID? Where can I get it? How can I catch it? Do I need to wash my hands? Do I need to wear a mask? Like what is going on there? Healthcare fluency has a big piece of healthcare literacy, right, which is understanding the system, but then it goes also into the scientific knowledge piece as well. So if we use COVID again as a really great example, like, do we know, right, how it works, how it spreads, what a vaccine is, what mRNA is? Do we know how the system or the pieces work, right? Where can we get a COVID test? Where can we get a vaccine? And when we think about the third component of healthcare fluency, there's a lot about perception and a lot of cultural perception. Oftentimes we'll hear about people who maybe don't understand or not are engaging or who are not going to the doctor's office, right? But forget that there's a lot of culture behind that. Myself, I'm from Puerto Rico, and more recently, right, I know stories of people who had really, were sterilized against their will, or without their consent. And so there's a big piece of that cultural perspective, what we carry with us, but also sometimes, right, maybe it's a more holistic approach than another. And I think that goes back into then, right, like this personal confidence. So what has been my experience? What has been my experience with the healthcare system? Have I been listened to? Have I gone in really trusting and been shut down? Have I been medically gaslighted? And maybe it's not me, maybe it's my family. And so as a whole, when we think about the state of healthcare today, it's complicated. We don't trust it. We're not engaging with it. Ultimately, it's not just a lack of healthcare literacy, although that's a more common term. It really is around healthcare fluency. And I have a few words in Spanish, right? And I can speak Spanish really fluent. I have a lot of words in Spanish, rather. I have like 3 words in French, right? And it's not just, I can know the words, but can I use them? Can I apply them? Can I understand them? Same thing in finances, right? Like we can know what a budget is, but like, we know what money is and maybe we use it every day, but do we understand the complexities? Are we fluent, financially fluent? And so in this frame, we kind of we'll continue to use this like lens of healthcare fluency as we go out. What we know is that for folks, right, who have low healthcare fluency, right, it's not enough that the system is complicated, it also costs us. And maybe some of y'all are experiencing this, day to day, but for right now, for people who are on Medicaid and have what is traditionally called low health literacy, we call it fluency, they pay about 4 times more for their healthcare. So about $10,000 compared to $2,000 per year. And it's just a waste and a drain. And we're not just losing money. These are actual lives that are being caught, that are in the balance right now. And so where we are today, right, we're at a moment where COVID-19 has dramatically increased access to telehealth. It's put really a big old, like, let's throw some tech at this. We're in the middle of like innovation central, right? What can we do? And I think for me, the biggest challenge that I sit with is when we think about innovation, when we think about coming up with these new cutting edge technologies, we're really looking, and what's out there are a lot of technologies that are being developed that are transactional. How can we create a transaction or make this transaction easier? And at Radical Health, we really, really believe that this can't just be transactional, or innovation can't be transactional. It really needs to be transformational, not just for the people or the communities that we're working with, but also within the system. So we're here to do that a little differently at Radical Health. We always say we're paving a new path for health. And a lot of that is really centered around community. I mentioned earlier, we work to engage and equip and empower people to understand and advocate for themselves in healthcare. And we do that in a few ways. So one are through our online circle conversations, which we'll talk more about. We bring people together to have these conversations, to share their lived experiences. We then equip them, right, with access to information through our chat app where they can text, they can know what questions to ask, and really know maybe their rights. I often joke that like I spend more time watching Netflix previews than I do thinking about, my son has an appointment tomorrow, I have an appointment, what am I gonna ask, what's gonna happen? And through this engagement, through this, equipping folks, it's really a sense of empowerment to build community, again, not just in community, but also with the healthcare system. So we're all kind of looking at this from a new way, but also using some of the tools that exist already and new tools to get to that transformation. The way that our work works is we use this analog and digital combination. So you can join a circle, like a real circle where you're chatting with people. Right now we're in like a panel discussion, but what I invite you to think about is maybe sitting around like a circle, sitting around a fire, having real conversations. In this case, we're online, so all of these happen online. But having these conversations online, talking with one another, figuring out, sharing lived experiences, sharing what's going on. And then whether it's before or after that, asking questions so that you know, right, what questions you should ask. This is a little bit about our circles and kind of how they look. And essentially it's building trust. It's building like this connection that happens beyond just the clinical encounters. There was a study done recently, and I'll cite a few things from here, but it was published in Femtech Insider. And what we found out were that for people who identify as women, about 31% of them say that their health concerns weren't taken seriously when they went to go speak with the doctor. And what we find is like a lot of us, at least in our innovation and in the tech and this is what we're building, we try really hard to make it easier and make things a lot easier. But what we don't often create space for is how do we take one another seriously, share peer knowledge, share information from peers, and then work with kind of the existing system, whether it's clinical or not, to then get what we need and feel, again, more empowered and engaged there. Our chat app, which we talk about here, it's not just a chat, but it's a lot more than that, right? When we look at especially maternal mortality or morbidity or any of these things, right, even if it's opioid use, we tend to measure at the end, right? So what is the most horrific outcome? How many people are dying? That's what we measure against. And what we often don't measure early on are what are the instances before that where interventions or things could have been changed to make a difference. So when we think about this, this is a demo. We're looking here at someone who couldn't get an appointment. And we work with them, right, to say, hey, if you have an appointment, even if it's weeks out, you might want to keep it. You can ask to be put on a cancellation list or call every day. In the event, right, and this can go on and on, you can't do that. You can always find another provider. Here is where we start to see what are the instances that happen before maybe a horrific experience that we could be paying a little bit more attention to. So for this person, they couldn't get an appointment. They were having a lot of trouble here getting an appointment. Then they had questions around an alternative way to test for gestational diabetes. We don't know the details here, but we know that, okay, you're looking for something else. And then we get a question of like, should my doctor be examining me without someone else in the room? This is early on. We also kind of track, where, we get some other additional information. But because this is early on, this is one of the things that we'd identify as, where is this person? And when we think about the long-term view or the aggregate impact that we could have is beginning to say, okay, like what else should be happening at a system intervention to make it easier to get an appointment? Maybe it's the phone tree, right? Or maybe it's that, this, and we've seen this a few times, this clinic, right, has a wait list for folks who are uninsured or on Medicaid. And so what we're doing is working kind of on the ground with people, but again, impacting the system. And through this process, giving people questions to ask, really beginning to address that health fluency challenge that we heard early on. Some of our work when we've done this, right, no one thought this was a thing, right? It was really tough to get started. But what we found was early on, there were some champions who were like, okay, we know that this is an issue. We know that we don't have a lot of time with what people will call hard to reach populations. We center with historically marginalized and unheard populations. We don't know how to reach them. We don't know what to do. Especially when we think about people who are of reproductive age. And we know there was, in this other study, in the Femtech Insider study, they recently did a survey. It was 44% of people who identify as women put off, right, seeing a doctor until much later, and sometimes much more serious, impacts to their health. We talked earlier about how 31% of the same people who identify as women said their health concerns weren't taken seriously. That number actually jumps to 45% of women people who identify as women between the ages of 20 to 34. And more than that, right, to kind of look at this challenge, 31% of people who identify as women felt rushed within their appointments and felt like they couldn't get all those questions answered. And so with our clients, we have a few of these clients who said, we know that these are issues. We want to do something about it. And we've gone down a few paths. So we've worked really closely with public health departments to set up a series of circle conversations, to listen, to understand what's happening in the community, to understand what people are saying that isn't making their way through to the folks in charge of changing the system. You might be able to find it on a Facebook page, maybe if you Google your local hospital, clinic, health department, but that's not making its way into the system to make a difference. And so in one of them, we worked with the Department of Health here in New York City. And one of the things that came up, we've been doing some work and talking about opioids. And after chatting and having a lot of community conversations, we went back and told the Department of Health, hey, no one's using the word opioids. Just not a word. No one's like, I'm going to go get some opioids today. And, it's one of those things that seem really, really simple, but has a great impact, both like on money saved and like action, and then also like in lives targeted and reached. And so a lot of our work centers around working with public health departments, working with hospital systems, population health, case management, and also working with employers. So that's one of the other things that we've been working on more recently is with some of our clients, really knowing that you have people who are at work, who represent and who maybe this is their first time having health insurance benefits and they get that packet and it's like circle one and you have your best luck. But again, not knowing how to engage, not knowing how to ask questions, and also not being seen. And so more recently, we've been working with a lot of employers to help support their employees. I'm going to pause here because I'm sure there might be some questions. But a lot of our work, when we think about the intersections of innovation, of tech, our secret sauce is that it's people, always centered. It's using tech not as a means to an end or as a full solution, but really as a support, right? Or an add-on. And then it's really using the data and the tech that we have to work with systems. So this isn't like I'm going to come and get you, but it's like, let's come alongside each other, use the tools that we have to begin to make a change.
Well, I'm enjoying this so far. So I do have a few questions. I may wait until the end, but let me just pause and ask anyone else that's on the line. If you've got any questions, feel free to go ahead and chat those in, or if you're so inclined, come off of mute or on camera at this time and go ahead and ask your question yourself. So, and I already see we're getting some kudos in the chat that Cheryl is saying it's an amazing presentation. So far, so thank you. And we did actually, when folks registered, we did ask them the opportunity to ask questions at that time. So we were able to kind of pre-populate some questions for you. So one of the things that came to my mind as you were chatting was, this is really fantastic. Who did you contact at the health department to be able to kind of get that foot in the door? Because I know that that's something that some of our communities struggle with, is reaching out and never getting a response back. And sometimes it's just because they don't know the right person to reach out to. So I'm curious if you could talk a little bit about like how you actually got that in at the health department.
Oh my gosh. All right. The truth, I could pull together like a really packaged answer that's like, oh, but the truth is it was really hard. And what I'll say is I started this on my own. I didn't really have, I had a background, but it wasn't enough to like move mountains. And so one of the things that I noticed early on, and one of my hacks for anyone who's looking to do some of this work, was I actually didn't go to the health department first. I should have mentioned that. Our first client was actually the Department of Education. And the piece around that, and that's actually some of our strategy that we still use today, is that sometimes healthcare, I mean, anyone who's in here, it's not the easiest, and it's a little bit, I'd say it's a little slow moving and a little set in its ways. But what I found were other sectors who were way more eager and had way more agility, especially because health was not their kind of forte or their strength. They were much more willing and able and open to work with us. And we're still working with the same population. So if you look at this from like a structural or systemic, determinants of health perspective, they're always connected. So my advice is, if there's something like, adjacent. So for us, it was the education department that we went into. They took my calls very easily. They were like, oh my gosh, we've been waiting for this. Like, we've been trying so hard, blah, blah, blah. And that's actually what got me in and then allowed me to, move over. In other cases, it might be, a music program. I mean, if you look at it again with that lens of like the structural determinants of health, everything is connected, whether it's food, education, justice, criminal justice. So figuring out whatever is the closest to you, and then maybe using that as leverage to get into maybe a more traditional healthcare system.
That is excellent. Thank you. Great point. And let me stop because I see one other question in the chat from Amy, and she's asking, what's the most important thing providers can do to support health fluency? And then a follow-up question is, what about maternal health professionals in public health?
Again, I wish I was like part of what I say, and my method is always to say that, like, I don't have all the answers often, because I think it is a really great question, but like, I often don't have all the answers. And that's actually my, I think, strength, and the strength that we bring to Radical Health. When we think about providers looking to support health fluency, there's a few things. One is, how are you sharing your power? Early on, we talked about, right, the access to healthcare. It's a wall that you have to get into. My first time when I graduated high school, I thought I was going to be a doctor. I was like, okay, cool. I'm going to go to college. I'm going to be a doctor. I showed up at undergrad, like, okay, I'm going to be a doctor. And they were like, oh, no, girl. Like, you're at City College. There's no way, like, you just don't show up to be a doctor. Like, you got to take biology and chemistry. And so there's like a paywall, I say. You either pay it in dollars, you pay it in social currency, you pay it, right? And it's access to information. So for providers, I often say, how can you share that? So whether it's sharing your information that using simple language that people can actually understand it, but also I'd say, listening deeply. Again, more recently, I have a friend who has cancer. And while the oncologist is treating them day in and day out with chemo and what's happening, the oncologist has not once asked, hey, how's your mental health? How are you feeling? What's going on? And so for providers who can support health fluency, I think that it's a space of like sharing as much information as you can and will, and maybe a little bit more, inviting people to bring in their full selves. So when we talk about cultural, like even the things, I have all these examples, but when we think about COVID, we did a lot of work around vaccine. And what people were saying was like, oh, we need people to take vaccines. And our approach was to take a harm reduction approach. So if you don't want to get a vaccine, that's fine. I'm not going to force you or tell you or convince you. What are your plans in place to keep yourself safe until you decide to get one, if you decide to get one? And so I think about that in terms of fluency, allow people to bring all of it, even if it's a little contradictory, into the space. And then for maternal health professionals, especially in public health, this is actually one of my, I love this work, and we do this work, and I don't know if I mentioned that, but we support, people who are pregnant or not pregnant. We do general support around general health. We've done a lot of stuff around COVID. Maternal health, I think, gets tricky. I think there's a lot of stuff that you can do clinically, right? But it gets tricky because even there's a system, I think, at play. Maybe that's a better way of thinking it. There's a system at play. If we look at it even from like coverage, right? How long is a pregnant person covered? When do we begin to have conversations about reproductive health? Like, is it only when a person's pregnant? What happens before that? I think there was a lot of pieces that are at play. And I'd say the best way to support health fluency in maternal health, at least, and for public health professionals, so even maybe start a lot earlier than just when it's around maternal health, maybe just, at the beginning for everyone.
Thank you for that. All right, let me pause and see if there are any other questions that folks have, if they wanted to come off of mute. Okay, otherwise I'm going to keep going if that's okay. Or actually, let me stop. Are there any other additional slides that you have that you wanted to share or additional presentation? Okay, all right, so this is all Q&A time. This is even better. Okay, let me ask, when we think specifically about like innovation in maternal and child health, when you started this work, did you recognize that what you were doing was actually innovative?
Oh, I knew it was hard. I didn't know that like trouble and innovation, kind of like collide or intersect. Um, I didn't. A lot of what I'm doing and what I had been doing was really using a model of like I use indigenous circles, which is how we started. Like it's indigenous, it's circles, it's not a big deal, not in my mind. But I didn't know that it was innovative, and it wasn't really until yeah, like we started doing this in systems, and people started getting scared. That was the first one. I was like, oh wow, like what do you mean? And then it wasn't until we started like, yeah, seeing like real people asking us questions and joining in and sharing their stories, and learning from one another. We had one person who was a young, they were intergenerational, so an older person in their 60s and a younger person probably in their 20s, both identify as women in a circle. And the one older person would be talking and sharing, and the younger person went first, and she talked about her journey with lupus and getting diagnosed and figuring this stuff out. And then it went around the circle to the older person, who was in her 60s, and she said, oh my goodness, I have an appointment next week, and I think based on what you said, I think I have lupus. I've gone to the doctor, no one could diagnose me, I don't know, but this is what it is. And at the end of the session, they connected and they stood in touch. And then I got in contact with the older woman a few weeks later, and she's like, I have to tell you something. And I'm like, what is it? She's like, I have lupus. And I'm like, oh my God, just really feeling. And she was so excited. She's like, no, this is great. I didn't know what it was. And if it wasn't for the moment for me to share, with my peer here, and to kind of the earlier question, right? The ability, one, to like reach people earlier, but I think also to have intergenerational support, especially in maternal health. There's a lot to be had and a lot to be said and a lot to be done. And so it was in that moment that I was like, oh, wow, this is wild and innovative, and could be something new.
Absolutely. Agreed. So I'm curious, as you've started the journey, what advice, because you've been doing this for a little while now and thinking about it for quite some time, what advice or lessons learned do you have for other innovators in the maternal health space?
Yeah, I think, maternal health is different, and y'all can correct me if I'm wrong, but from what I see on the outside is that it does seem really collaborative. It does seem really community led and supported. So for everyone kind of doing their own initiatives, I hope, and what I see is that there is a lot of just collaboration because we're all in this together. And so my advice would be to continue that. I'd say, some of the other pieces are, like how do we also incorporate kind of outside, like other, I talk about other industries and other partners. So how do we do that? How do we get, we live in silos. So how does I would say for the maternal health, if you're in maternal health, like you're not that far from pick another sector. Even what we've seen in our work has been maternal health and criminal justice. So thinking about people who are pregnant or experiencing pregnancy and their partners, and where are they, and kind of vice versa. I would say that like my advice would just be like, think about all the other intersections and build in those ways.
Sounds good. Okay, so let's back up just a little bit and talk more specifically about your innovation. So the app that you developed, the circles, how you are finding the folks that are participating in your circles, like how you're getting them to like continuously participate, what's the experience like for them, how long they stay in it, and then how you're able to share some of that data that you're learning back with the health department or back with the providers, and if you have any of the data, how you know that this is actually working to change or improve some of the outcomes that we're seeing.
Yeah, so this is such a good question, and I often kind of fly over it because I'm always so excited to jump in. But I think really kind of concretely, we run what's called in business a B2B2C model. Those letters basically mean that we have clients who we work with who hire us and pay us, and then we work either with their members. So it might be there. We don't use the word patient, but like the community members, whoever they're connected with, or for their employees. And it's free to those end users, we can say, right? So we don't charge anyone $1 to participate. And in fact, sometimes depending on what we're doing, we'll often kind of reinvest and compensate folks to participate. Everything that we do is really centered around, I call it, equity, like we really use an equity model. And so trying our best always, especially in communities that are, largely Black, Brown, Indigenous, immigrant, poor, really trying to like have some economic impact there too. So trying to reinvest there. The way that people come to us, again, it's through those partnerships. So in the instance of with Tacoma Pierce County Health Department in Washington State, we work with them and they get the people with us. So we kind of work in collaboration, but they'll bring us the people who work with us. Then the experience really, it's a lot of it is we build with our client. So some cases, some folks want to lead just with circles first. So we'll run a year-long series of circles. We'll come up with a program series, and that allows us to do what we call kind of like hyper-local community needs assessments, where people are, and that's like fancy words for saying we just get to listen and then we report back to the client, whoever it might be. This is what we see, this is what's going on, these are some of the trends, and these are some recommendations that you might want to implement or work with. In other cases, folks will run kind of two at the same time. So they'll run circles and access to the app for folks who participate in the circles, where they can then chat and kind of build ongoing. And in those cases right now, we're doing that with a few clients. This year, we're rolling out a little bit bigger. So we'll begin to see those a little bit more and have more data points there. But we know that on average, folks are texting with us or chatting with us for about 90 minutes. And they're asking, 1.5 questions kind of per engagement. These are the things that I'll say, like, we love, working with and collaborating with. So if there's anyone here who wants to try that and test that and, like partner, that's something that we really enjoy doing. A lot of our tech and the way that we build, we've been really intentional and some might say slow with it, but it's really, we build with community. And so I think that's the one other facet that I want to highlight too, in terms of our innovation. It'd be easy for me to build an app and just throw it out there. And we did that, right? But part of this has been building. We have community builds. So before we launch into a new state, before we launch into a new segment or market or with a new client, we sit down with like key folks in the community. We use AI, so it's a little like seeding the app, but we basically seed the app with like the culture, the dialect, what's important to that specific demographic. We support English, Spanish, and French languages. And that I think has kept us, and I'd say that's the one other piece, like word of advice that I'd offer as we're thinking about innovation and tech. It's easy to build an app. It's easy to have someone build you an app, right? It's really challenging to build an app that is conscious and aware of bias, and one that is built really for the people who's intended to be built with. And so part of our approach really has been allowing the circles to kind of build community, build support, layering that in with our app, and then continuing to iterate on that our app and build with community, just to make sure that we have a really niche population. So unlike some of the other innovations that are for, it's like $30 a month, and you might, it's more of a subscription for like, you have like a socioeconomic, like, like different buckets. Like we're really working for a specific population, and want to make sure that it's always accessible, attainable, and more than anything else, does no harm.
Yeah, I have a quick question, and thank you for that, Ivelisse. Um, you said something really, I think, ingenious in the beginning about um, fluency. And I think oftentimes when we think about innovation, we immediately tie it to tech. And I think we see in the healthcare space millions of dollars going to tech, but not really making an impact. And so I guess from your vantage point, what are some things that can be implemented that can have impact, but not directly tied to tech?
That is so good. I'm going to tell you a big dirty secret. This is recorded, so I guess it'll haunt me forever. But most tech companies that you see, especially the earlier stage ones, the ones that are all leading now, they are held together with bubblegum and duct tape. In fact, many of them don't really have like proper tech solutions, or they're using like an Excel sheet that's tied to a Google form that's tied to like somebody's grandfather typing away. And I think that there is a big misnomer that like you need to have tech in order to have impact. And I would say that like you actually don't. And I'd say this specifically when we talk about, and again, I center Black, brown, immigrant communities that are really within like really high levels of concentrated poverty. That's kind of our sweet spot at Radical Health. Those are the people that we work with. For the most part, people, it's not that people don't have like cell phones or that they can't access the tech. In fact, majority, about 97% of folks, their primary way of accessing the internet is through their phone, through their smartphone. So it's not that that's the challenge. The challenge becomes like these apps are just not easy to use. So our technology, even our chat app, while we have a back end, it's really on WhatsApp and SMS. We actually moved, we had a native app, we had an iOS and an Android app, and we scrapped it and went actually to SMS and text message. So to answer your question, Alexis, I think that tech is never, ever, in my, what I've seen, it's never, ever, ever the answer. It's not, and probably won't be. It can be a part of the answer. It can be a part of the solution, but I think more often than not, like tech should really be used as an assist and not the full shebang.
Awesome. Thank you for that.
I would not have anticipated that answer. Thank you. Can I ask, over the past year, what changes you saw with COVID and how that forced you to pivot a little bit and offer your services in a different way, and in such a way that works so well, hopefully, that you're going to actually continue with that pivot or with that innovation as we move forward?
Yeah, no, and I actually might need to backtrack a little bit now that I say this. So I think what happened for us in COVID, our original model was that we did these circles in person. They were always in person. They were never, in fact, the platform that we had it a few years ago, and it was built and it was ready to go. And I was like, we're never using that. We're never using it. Circles should never be online. And then COVID hit. And so basically all of our business, for the most part, because we use Circles as an onboarding into our chat app, like, was all garbage. And we're like, oh my gosh, what are we gonna do now? And what we found was, I mean, the pandemic really brought us, right, with a full upswing and uptick in tech, especially using Zoom and using online video chat, especially in the Black, brown community, which I think hadn't happened before. I think when we think about like the early users of health tech, definitely didn't represent the communities that we work with. And so what we did was we had to adapt all of our work, turn it into online circles. That was one of the biggest changes that we are likely going to keep. And then the other thing was our app was solely around maternal health, was only around helping folks, right, navigate and know what questions to ask before, during, or after pregnancy-ish, right? Like we kind of span the full reproductive justice spectrum, but we're really focusing in on maternal health. And COVID happened. And so we actually had to adjust our app to not just support people who were pregnant or going to be pregnant or had recently been pregnant. We had to support COVID. There was no way that we could go out, and like not help people know what a vaccine is, where to find a COVID test, what is COVID, where do you get insurance, where do you get WIC? So for folks who are looking for supplemental, like WIC programming, like how do you get WIC? Because you had to go in person and you couldn't get it, at least in New York where we were working, you had to go in person to certify. And so that was the other big change, which if you notice, like some of our stuff, like we were only doing maternal health and then we had to do COVID. And then it became, I have a kid and I have a partner. And so we really then needed to support general health. So in many ways, COVID, it slowed us down a little bit, but then really gave us like the push to like even expand our services and our offering to really be radical in terms of like the full health spectrum and not just centering in on maternal health or kind of like the niche that we had really been in.
And actually, let me piggyback on that because you mentioned earlier, I think you're in various communities. Is that right? Or is it multiple states also?
Yeah. So
Can you
this
share a little bit more about like where all you're located? And I ask this because we've got a couple folks on a line that are multiple places, but for folks who may be watching this later, many of our moms and state MHI participants are kind of all over the US. And so my leading question is like, how can they work with you or how can they get folks also involved in the services as well?
Yeah. So again, I'm just gonna mute this. Okay, thank you. We do work across a few states right now. Part of our work, the way again that we work is that we have clients who like hire us or we work with them, right, to figure out funding. So part of our goal for the end of this year and early next year is to be have more presence in 4 new states. So we'll be adding in. We currently are in New York. We're doing work in Tacoma, Washington, California, really looking at Oakland and Philadelphia are the areas that we're really kind of focusing in on. But if you're in one of those states that we didn't mention, we'd love to like chat with you. And so we also have, we have a few other folks, and basically it's like, who do we want to work with, come alongside, and then we can work on like what an implementation plan is. We also have some national clients that are across the US, and namely those are payers. So working with our payer client and a few other hospitals. So at this point, our goal really, we're a young-ish organization, so we're about 5 years old. Our goal is to continue to expand, and so that hopefully next year when we check in, we're servicing a majority of the US and the states that are available.
I would love to see that happen. You must have like read my notes. I don't know how you did it because I was gonna ask like over the next year, like what do you think your vision would be for how you guys are going to grow over the next year? So it sounds like expansion into multiple communities. And then let me also ask, because you'd mentioned, when you guys first started, this was really just maternal health focused, and folks talked about like, other family members. Is it all, how do I ask this? Are any other caregivers part of your circles? So are we seeing grandparents? Oh, okay. So I see you nodding. Okay.
Yes. So the beautiful thing about our setup is that, anyone can join a circle and anyone can ask a question on our app. Some of them are very specific and they might be like for people who are currently pregnant within a zip code, right? That just might be the niche there. And so, but oftentimes you have other circles, sometimes you just check in. So it's open. And other caregivers, part of our next series that we're going to be running are for partners of people who are pregnant and really inviting them into being advocates and supporting kind of the journey. And so to your question about like, where we want to be and where we're going and like how we grow from here, I think it is really much like we want to expand to these new areas. We also want to think about new tools and tips and tech and things that we can do to also make this like journey towards like health fluency a little bit easier for the folks we serve.
That is fantastic. Thank you. Happy to hear that. It's going to be super exciting to watch the progression. So I know we only have a couple of minutes left. Let me just acknowledge one there in the chat. There is an evaluation link. We do really take your feedback seriously and try to build on every different webinar and podcast that we offer. So if you could take a moment to complete that, we would certainly appreciate it. Just to thank and acknowledge the team for being on the call and helping to put this together. Thank you, Evelise, for your time today and for sharing with us. We're excited to watch you grow. And then I also just want to ask the folks that are on the call in our last minute left, any other questions that you have? And Evelise, can I also ask if you could put your email? I know you had a slide earlier. If you wouldn't mind putting that in the chat. Oh, fantastic. Thank you. So if folks have additional questions for you, or if they want to find out how to get folks in their communities involved with Radical Help and offer the services, the app, the circles to some of the families in their community, is that the best way to do that, is via your email? Okay, fantastic. Well, thank you everyone for joining us. I hope this was value add for your day. I hope this has got you thinking a little bit more about like next steps, innovation, what that means, innovation in maternal health, like for you, how you might think through working with Radical Health and exploring this in your own community. There was one other thing I was going to say, now I can't even remember what it was. Oh, we've got, so again, another Innovation Thursdays, which is going to be scheduled very soon. We're trying to do this the first and the third Thursday of every month until the end of October. So there will be more information on our website. So do please make sure that you check back in with us. So we're going to keep these conversations going. Again, this is just an opportunity for us to invite some individuals and some organizations to share their innovations with you. We're excited to learn all of the different ways that folks are really helping to improve maternal health outcomes. And so we hope that you'll be able to take something from it and implement this in your own communities and at your state level. So lots of thanks in the chat. Thank you again to our presenter. Thank you for our team. Thank you to our participants. We hope you have a wonderful rest of the day, and we look forward to seeing you again very soon on an Innovation Thursday. And thank you again, Ivelise. Much luck, many blessings to you. Thank you.
Thank you. Bye.
Bye-bye.